welcome to tonight's episode of Beyond Focus TV. I'm Lydia Patel, and as always, I have a very special guest for you, Dr. Lynn O'Connor. She'll be with us for the next 30 minutes talking about colon cancer, so you'll definitely want to check it out. Stay with us. You're watching Beyond Focus TV.
Beyond Focus TV allows you to discuss contemporary topics affecting the Caribbean people on both a national and local level. The show features informed guests who offer insight, debate, and evaluate various issues. Beyond Focus TV builds on the station's mission to provide useful information to the Caribbean people in New York and abroad. Beyond Focus TV, where our viewing audience can get educated, informed, and empowered.
Welcome back. You're watching Beyond Focus TV. I'm Lydia Patel, sitting here with Dr. Lynn O'Connor. Dr. Lynn, welcome to the program.
Thank you. Thank you for having me.
It's amazing to have you here to actually be tackling such an important topic like this, as we get closer to the end of the year, people are going to start wanting to, make those New Year's resolutions,
Absolutely.
Start thinking about their health a little bit more. I think it's important that we actually have this segment. So let's get straight into it. Kind of give us a little bit about your background and how you all got started before you became Dr. Lynn.
Absolutely. I'm Dr. Lynn O'Connor. I was born and raised in Queens, New York. I am a product of the New York City public school system. I went to Bronx High School of Science, and then from there I did my undergraduate degree in science. Got a Bachelor of Science at Rutgers University, New Brunswick, New Jersey.
Mm-hmm.
And then I wanted more of a global perspective of health and healthcare before I went into medicine. So I got my master's degree in public health at Yale University School of Medicine.
Wow.
And then from there I went a little further down south to Temple in Philadelphia, Temple School of Medicine, and I got my MD. I did my training in Maryland, and that was 5 years of general surgery, and I realized I wanted to do colorectal surgery specifically. So I went to Atlanta, Georgia Colorectal Surgical Associates, and did my fellowship year there.
That is amazing. So definitely she's certified. she's official. She's got all the credentials you could want.
And I came all the way back home to New York.
Of course, you got to bring it back home. You have to bring it back home. But how has those experiences, a little bit of Jersey, a little bit of down south, how has that all shaped, where you are today?
I really love being in different parts of, especially the Southeast, the Northeast, and every area that I've been in, I've been able to work with wonderful people. I've had phenomenal mentors. I've been in different hospitals. So you get a respect for different types of hospitals, how they work, their patients, patient care. And it just gives you more of a different perspective. So it's only just made me love medicine even more and wanting to help people even more.
So when you decided you wanted to have, as you worded it so amazingly, a more global view of medicine, you could have just went on and completed that, but you wanted to go get a little bit more further
Yes.
than that.
I always knew I was going to be a doctor. There was no question about that. That was something I was interested in ever since I was a little girl. I could say as far back as 3 or 4 years of age, I wanted to be a physician. It was for different reasons, because when I went to the pediatrician, and we would have, I couldn't stand needles. So I was like, there's going to be a better way, and I'm going to find it, and we're going to treat children. But, over the years, my interests evolved, and I wanted to be in a field where I could really make a big difference in the preventative as well as the curative and the diagnostic. And this is an area where, especially with cancer, that you can do a lot of education, you can do a lot of outreach in the community, and you can bring people in so they can take a little bit more of an active role in their own health care. And, you can make a difference.
Absolutely. And then when you finally got to start practicing, how was that for you when you're certified, you're back home, you're working?
It was, well...
And I see a smile on your face thinking about it. I love it.
It's nice to be back home, but it was a little culture shock coming from the South back up to New York, but home is home. And it was phenomenal. It was absolutely wonderful to really be able to put all those years of learning and training, to hone your skill and to just be of service to people. So it's something that I love. I do every day, and you don't get bored. You're really making a difference. Every patient is different. Every diagnosis comes a different way. Every treatment is different. So it is the colon, the rectum, the anus, and you're looking at a colorectal surgery, but each operation, each patient, each interaction is different, and it's specific to that patient.
That is truly amazing, and it's important because a lot of times, especially when you're dealing with cancer,
Yes,
have to connect with your doctor. I mean, you sometimes are that little glimmer of hope.
You have to. It's very important, especially in the areas that I work in. They're very intimate. Sometimes it's embarrassing. Patients don't want to discuss bowel habit change. Some are brought up where it's very taboo to talk about those things. So it's important to be able to have a rapport, establish a rapport, a connection with your patient, so that they trust you and so that they can be open with you, and so that they listen to you. They're going to follow your directions. They're going to take the medications and the prescribed regimen that you do. But you've got to first, make sure that they know you care. You got to first establish a rapport with them. You have to first listen to them and be able to appeal to them. And you speak about being in several different areas and several different hospitals. You get to hone those skills. So it doesn't matter where you are, whether you're in the United States or outside the United States, you're able to connect with people and make them feel comfortable.
Especially working here in New York, I think you get every culture under the sun. So this is like the UN here. That's the beauty of why I love it. And it is. I mean, we live in like one of the best places in the world if you want to have access to so many different cultures. But I think you have to have that sensitivity.
You absolutely do, and you have to be able to relate to different cultures and understand that there are some different religious aspects when you're examining patients. There's different cultural aspects that you need to take into account and be mindful of when you're dealing with that. So it is very important. And I mean, I deal with men, I deal with women, children. The youngest is usually about 13. I don't go any lower than that. But all ages.
And that's amazing. What ethnic group would you say has the highest rate? You know how certain fibroids are very common in black women. Is there a certain ethnicity or age group that's more prone to colon cancer?
Well, colon cancer is the third most common cancer diagnosed in the United States of America. And it's the second most common colon cancer in men and women combined in the United States. So when you're looking at that, the American Cancer Society estimates there's going to be about 137,000 new cases diagnosed this year alone. And of that, about 50,000 people will die from their disease. But by far, African Americans, stage for stage, have worse outcome when it comes to colorectal cancer. So it's very important that this message definitely gets out to everyone, but specifically the African American community in terms of getting screened earlier rather than later, because typically the screening guidelines are for age 50. It's important.
Yeah.
A lot of folks don't know that. But when you're dealing with...
You think you're out the woods. Like, oh, well, I still got time.
Yeah, exactly. But when you're dealing with African American folks and you're at a point where it's just average risk screening, they should be done at 45 rather than 50, because of the fact that when we're diagnosed, it's usually at advanced stages. But if you have a family member, such as a first-degree relative, being mother, father, brother, sister, and their colon cancer, say they were diagnosed at 45, you want to screen 10 years earlier, so looking at 35. Exactly. Obviously, if anyone has any signs or symptoms, they need to come in and get screened immediately. And it's very important to pay attention to those signs and symptoms.
And I wanted to go straight into that. What are some of the signs and symptoms of colon cancer?
Well, the funny thing about colon cancer is you want to get screened before you actually get signs and symptoms, because usually if you have signs and symptoms, that means you may have a more advanced disease. But if you are thinking of signs and symptoms, rectal bleeding, the majority of rectal bleeding is benign, but a lot of people don't know that. They just chalk it up to hemorrhoids. There's more there, and it needs to be evaluated. So rectal bleeding, change in bowel habits, you're going more frequently, you have an urge, or you're even going less frequently. There's constipation, you can't get it out. The size of the stool has changed. The consistency of the stool has changed. Whether there's weight loss. Those are some of the things that you really need to look at in terms of the signs and symptoms of colorectal cancer. If there's anything that changes, no matter what age you are, whether you're 50, 45, or 25, you should come in for screening.
We'll hold that thought. We'll take a quick break. We'll be right back. You're watching Beyond Focus TV. Stay with us. back. You're watching Beyond Focus TV. I'm Lydia Patel, sitting here with Dr. Lynn O'Connor. So, Dr. Lynn, like we're saying, some of the signs and symptoms, by the time you actually start experiencing symptoms, it could be a little bit too late. That means that something's already started to progress.
Absolutely. And the thing is, a lot of people just ignore the signs and symptoms. They think it'll go away, or they, attribute it to hemorrhoids, or they attribute it to other types of anorectal disease, or, the bloating is just because they're not eating right. Those are signs that you need to pay attention to. And the longer you wait, and some people know something's wrong, but it's fear. And the fear will paralyze them, and they won't come in, and they won't seek a diagnosis, or they won't seek treatment from their doctor. So the earlier you get a diagnosis, the better it is that we can affect cure. I mean, stage 1 disease is 95% survival if we get it early. And when you're doing screening colonoscopies, that's the only modality that actually allows you to diagnose and treat right then and there. Because if you're doing a colonoscopy and you find a polyp, you can remove it. And it's usually those polyps that are fleshy growths that turn into a cancer. Because you go from a polyp to a cancer. It's the adenocarcinoma sequence. And most times that's when that happens. So if you can get those polyps early, before they actually turn into a cancer, you've accomplished the whole purpose of screening.
So my question is, how come this isn't done as part of a routine checkup? If this is such a high rate, why hasn't they made this a part of when you go for your physical? They check for diabetes, they check for certain things. Shouldn't that automatically be part of what you screen for at least once a year?
Well, no. You don't need to screen for once a year. There are different types of screening tests that can be done. Usually it's the primary care physician that will look at the patient and refer them to the gastroenterologist or myself, a colorectal surgeon, for a colonoscopy. Sometimes women who go to their obstetrician gynecologist will say it's time for you to have a colonoscopy. So it's really any of the gatekeepers or the primary care folks that are the ones who are going to say, listen, it's time for you to have your colonoscopy. But it's important for people to take control of their own health. And to sometimes ask for a colonoscopy. If you've had some of the symptoms, some of the signs, you have a family member, and you may not be the quote-unquote 50 years of age that they tell you, you need to advocate for yourself. But the average screening should start around 45 years of age. If there's a family history of colon cancer, it should start 10 years prior to the diagnosis of that person. If there's any symptoms or signs that come about, that's when they should get screened right then and there. If everything's fine, I recommend my patients get screened every 5 years.
Oh,
Now,
wow.
the American Cancer Society will tell you every 10, but I've seen too much happen within that 5 to 10 year mark. I think 10 is just too long. I think it's too long. But obviously, if a patient has a polyp, or if there's a cancer, then we start screening them a little bit more closer than that, and sooner than the 5 to 10 year mark.
So we've been throwing the word colonoscopy out there. Let's kind of get into what is a colonoscopy for those at home who, we've all heard of it. Colonoscopy,
Yes.
but
We've
what really goes on?
We've all heard of it, and we're so scared of it. But what it is, it's a routine screening test that is going to help prevent colon cancer. And when patients are actually getting their colonoscopies, the rates of cancer are going down. But the thing is, they're going down slower for the African American population. And there have been some studies out there that saying colorectal cancer rates in younger patients are going up. So it's an alarming study. So it's important that this procedure be approached with care and compassion, because a lot of patients are scared. They know they have to drink a ton of water and a ton of clears, and then they have to do the prep, and nobody wants to go to the bathroom all night. But it's important. It's very important to follow the directions for the prep. Make sure you're cleaned out appropriately. So if there is something that can be seen, we can take care of that. It's a procedure that's less than half an hour. You're home.